Thanks for visiting the patient and the weather today. I'm meteorologist Al Peterlin, and this is a weather report. We keep additional graphics at tpatw.com. We also maintain a storefront on Amazon. Not really a lot to talk about on the surface map today. We do have high pressure dominating almost all of the country, a few little elevation-induced bubble lows across the west, and one fragment of a front stretching from northeastern Montana through North Dakota and on across Lake Superior. Lots of unsettled weather ahead and along that frontal system. Looking at our lifted index, which is a composite of the individual weather elements that may have some impact on human health, you'll note we have something going on right up here in the easternmost portions of New Mexico. Lots of activity up and down the plains, and especially increased area across the Mississippi Valley into the Ohio and Tennessee Valley, but really extending all the way across the east except for the extreme coastal areas, but covering most of Florida. Pressure change is not really an issue at this time of the year. The pressure is rather stable, but we do have a little bit of rising pressure up here in the northernmost reaches of Minnesota and extreme eastern North Dakota. Again, we may talk about temperature contrast, but we're already cooking the frog, with meaning warm temperatures across almost all of the east, cooler temperatures here in the west. So we see an occasional bubble of increasing temperatures here in the west, especially Idaho, and then a few pockets of cool here still lingering in the east. But really, temperature is the issue, but not temperature change. Looking at dew points, you'll see that there's not a lot of change going on in the east, meaning the humidity is elevated almost everywhere. Dew point temperatures are high. Out in the west, we are trying to pick up the dew point temperatures just a bit, but not here in the southwest where the fire risk remains significant. Looking at vapor pressure, it's a little more interesting. It does show some rising vapor pressure here still along northern Florida and the very extreme coastal areas of the east, but it does show vapor pressure trying to fall just a touch, but really insignificant when we're talking about a degree or two, from maybe near 70 to down into the upper 60s. In any case, it's humid. Instability is another issue for this time of the year, and we can see that the most significant instability is moved all the way up into the upper reaches of the plains and the Mississippi Valley, Iowa, Illinois, Indiana, and even into the Tennessee and Ohio valleys. Note that Florida remains extremely unstable. Looking at the change in oxygen availability, it's far more spotty than typically. Normally we would have a broad swath here and there, but we have spots, in fact, for the second. Looking here in extreme western Wyoming at risk of migraine, note that we have a significant risk of migraine across South Dakota and a portion of migraine risk in North Dakota, probably just behind that frontal remnant that's hanging across North Dakota. Very interesting bubble of migraine risk from Kansas City to St. Louis and on into west central Illinois. Note that we have a bubble of migraine risk here in Arkansas, where it just kisses Memphis, and then across eastern Tennessee, also from central to eastern Nashville onto the mountains, risk of migraine. Note we also have a risk of migraine here across northern Michigan and then up and along the Canadian border, probably Toronto to Ottawa. Looking at the risk of asthma and arthritis, again very interesting, here from the toe of Idaho into southwestern Montana. A very significant line of asthma and arthritis risk from eastern New Mexico across the Oklahoma Panhandle into southwestern Kansas and trying to make it up into the Panhandle of Nebraska. Note we also have a very interesting, very shallow, narrow line of asthma and arthritis risk from Georgia along the Carolina coast across Delaware, New Jersey, probably much of Massachusetts, and then just the shoreline of Maine. Thanks for visiting the patient and the weather. Your comments are appreciated, and stay cool, especially overnight.